The most important time to brush is last thing at night before bed, if at all possible. The most important thing about brushing is to have a routine. Now, shifts change, rotas, staff availability, people may be more or less cooperative at different times. So as long as you brush at least one other time of day, it doesn't really matter when it is, as long as you can try and get in twice a day overall. Well, ideally in a bathroom where there's a sink, so you can spit out the toothpaste, because you should spit out toothpaste and not rinse. But if your bathroom's a bit small, you can't get in, or people don't like being in the bathroom, you can choose somewhere else where somebody's comfortable. It doesn't matter at all. The best way to brush somebody's teeth is actually stand behind them, and the person's mouth should probably level with your elbows. So if their mouth's level with your elbows, it's ergonomic for you, it's comfortable. If you stand behind somebody, you can support their head with one hand, the side of your body and your arm, and you can see what you're doing and you can use the other arm or other hand to brush. If that means you have to stand at a box or somebody has to sit in a low chair and you stand behind them, that's fine. Set it up, make it comfortable. If it's comfortable, everybody's comfortable, and you will do a better job. Okay, the technique of brushing is you need to brush where the teeth and gums meet, that little groove between the teeth and the gums. So ideally you would angle the toothbrush at 45 degrees to the tooth, and you would use little small circles or small scrubbing motions to just clean the plaque, clean the germs and dirt and debris out of that area. For bottom teeth, you brush down into the gums. And for the front teeth, this won't fit, so you need to do this. And for top teeth, upper teeth, you brush up into the gums. Again, routine's important. So if you divided the mouth up into 6 parts, upper left, middle, upper right, lower left, middle, lower right. And you remember that you've got to brush all surfaces of the teeth, so the cheek surfaces, down by the tongue, up in the palate, and then the biting surfaces probably last of all. You need to be really consistent with it. You need to always start in the same place and always finish in the same place. That way you won't forget anything, and you make sure that you manage to brush all of the teeth and all of the surfaces of the teeth, which is really, really important. After you've brushed your teeth, you should spit and not rinse, but some people can't spit. So you need to help somebody who can't spit by wiping out the excess toothpaste from their mouths. You can use some gauze or some soft cloth, nothing too hard or abrasive, and nothing with any detergents or anything like that on it. It's very, very difficult to know how long it takes to brush somebody's teeth. Sometimes people can be really, really, really good at it and really quick, and they can get away with maybe 2.5 minutes, something like that. Other people, particularly if you're assisting somebody to brush their own teeth, it can take much, much longer, and it can take at least 10 minutes sometimes to brush somebody else's teeth, or to support somebody to brush their own teeth, or just to watch somebody brushing their own teeth. You just need to look at the individual person that you're working with and choose the right time for them to make sure that everything is done, all of the teeth are brushed properly. If it takes maybe 2 members of staff to support somebody to brush their teeth or to be doing it for them, you need to set a time of day and allow enough time to do the job properly. So if first thing in the morning everybody's rushed and there isn't a lot of time and somebody's going to take 10 minutes to brush their teeth, don't brush their teeth first thing in the morning. Choose a time when you've got 10 minutes and you can devote that time to your client, and it actually can be a pleasant experience for them. It can be me time for your client. They're getting single individual attention, they're getting your undivided attention, and it can be a very positive experience for them. So allow enough time, don't be rushed. If you're rushed, people think you don't care. It's really important to choose a toothbrush that you can use, that your client can use, and is comfortable for them. These are ideal toothbrushes. They've both got small heads. This one's slightly tapered, so it might be easier to get to the back of a small mouth, but it doesn't make that much difference. It's personal preference. Not too hard. The bristles are all the same size. Narrow neck to get into the mouth of the back, and a reasonable grip for your client to get hold of or for you to get hold of. There are other toothbrushes that are very similar to that. This one is actually a child's toothbrush, but it has an advantage of a nice thick grip, and it's quite easy to get hold of. And your clients might find that easier to use themselves. Lots of people ask about electric toothbrushes, and they can be great. They can be really, really good. They aren't that simple to use. You use them differently to an ordinary toothbrush, and they don't save any time. Some people love the buzzing, and some people are really frightened by it, and you will need to work that out with the person you're working with. The right sort of electric toothbrush to have is one that is rechargeable, one without too many gimmicks, and it should have a round head that fits against the tooth and gum and can clean out the plaque where the tooth and gum meet. You need to almost brush the teeth one at a time with an electric toothbrush. You hold the toothbrush still against the teeth. You don't move it around. If you move it around, it doesn't work very well. There are also specialist toothbrushes, and they're designed to help you to brush different sides of the teeth at once. They come in different sizes, a tiny one and a slightly bigger one. They are quite bulky, so you need to take advice from your dentist about which one to choose. I think other sorts of toothbrushes which are often marketed and you see the TV advertising as being good aren't actually very good at all. They're just gimmicks. So lots of different size bristles, tufts at one end, the ones that have got bits of rubber in amongst the bristles, they're all not to be recommended. They're too complicated, and they don't improve on the basic toothbrush with level bristles, not too hard, small head. The right amount of toothpaste to use is a small pea-sized amount. About half the size of an adult's little fingernail is quite good. Use an adult toothpaste and put it on a dry toothbrush. Fluoride toothpaste comes in different concentrations of fluoride, and fluoride is a medication. So if you like the correct dose of fluoride for somebody who's over 6 years of age or over 25 kilograms, should be about 1,500 parts per million. Sometimes it's labelled as 1,480, that's near enough. Anybody who's smaller than 25 kilograms or under 6 should be using a fluoride concentration of about 1,000 parts per million. If you're confused about that, you can always ask your dentist or ask the pharmacist in any chemist where you might buy your toothpaste. There are some people who need much higher concentrations of fluoride, much larger doses, and there's some very good toothpaste available for those people, but it needs to be prescribed by your dentist. As I say, if you're in any doubt about which toothpaste to use for your clients, do make sure that you take advice from a dentist or perhaps a pharmacist.